Hi, I'm Dr. Laura Leahy, a board-certified psychiatric and addictions advanced practice nurse in private practice in southern New Jersey. Over the course of my 30 years as an APN, never have the needs for mental health care been greater than during the COVID-19 pandemic. Practicing in the most underserved region of the state, Cumberland, Gloucester, and Salem counties, I've received over 6 inquiries per day for treatment of New Jersey citizens of all ages, with reports that everyone they've contacted has a 4 to 6 month waiting list or is not taking new patients. Patients are lonely, they're in despair, schools have been closed, and if the children are in schools, they sit alone. Weddings have been canceled, so couples are fighting more. The elderly die alone or possibly with a healthcare provider that is unrecognizable in their PPE. Drug use has increased during the pandemic, and according to New Jersey Cares, we are trending toward the highest overdose death rate in the state's history, with 50 overdoses per day, 20% of which end in an isolated death or the inability to be reversed with naloxone. Not only has substance use increased in New Jersey, but suicide has become the third leading cause of death among 13 to 34-year-olds. New Jersey boasts one suicide every 11 hours. Across our country, people are experiencing the impact of the coronavirus, and there simply aren't enough psychiatric and substance use providers in our state to address this epidemic within the COVID-19 pandemic. Of the almost 900 psychiatric APNs in New Jersey, over half have their DEA-X waiver to prescribe buprenorphine for opioid use disorder. Yet patients have experienced obstacles in access given the changes to the delivery of care from office-based to virtual. We're not able to obtain drug screens via telehealth, nor administer injections like Vivitrol to aid in the recovery from alcohol and/or opioid use. COVID-19 has, for better or worse, changed the way in which we care for our patients as psychiatric mental health advanced practice nurses. Telehealth may not be the most effective form of treatment for some patients. Parents are overwhelmed trying to find a quiet place to have a remote appointment while struggling to teach their children. Concerns about health and safety have kept people from going to their providers' offices or seeking inpatient hospitalization for fear of COVID exposure. Patients seeking treatment for opioid use disorder don't want to go to an inpatient facility for withdrawal management, forcing outpatient practitioners to be creative in our approach to care and to safely manage withdrawal symptoms in the patient's home environment, checking in sometimes multiple times a day via telehealth to ensure that they're receiving relief without adverse events. Early in the pandemic, Governor Murphy signed Executive Order 112, allowing APNs to practice at the fullest extent of our licensure, education, and training. This has removed barriers and has allowed APNs to provide timely, cost-effective treatment to New Jersey citizens, unencumbered by collaborative agreements and joint protocols. Moving forward and further empowering APNs to practice to the fullest extent will provide New Jersey with a workforce of over 11,000 APNs, not only in the treatment of psychiatric substance use disorders, but all areas of health to meet the need and improve access to care for all New Jersey citizens. APNs will continue to collaborate with our medical and nursing colleagues, as well as with New Jersey legislators, to enhance and improve New Jersey's healthcare system, which will benefit everyone. And since all health begins with mental health, especially during the COVID-19 pandemic, the mental health and well-being of New Jersey citizens is paramount to minimize the rising suicide and overdose deaths that have drastically increased due to the diminished resources and inaccessible care in our state. Thank you.